So street medicine for me is bringing healthcare to the most underserved in our community. Those that are either unsheltered, homeless, or in shelters, trying to bridge that gap in healthcare where we know that those people that I just described are not utilizing healthcare, though it is available. For a multitude of reasons. It could be mental health issues, it could be substance use issues, it could just be geographic location of where they're at and their isolation, or a combination of those things. And so by going on the streets and seeking out those individuals where they are and bringing health care to them.
Street medicine is being able to bring med services to our houseless population and provide them services that they normally wouldn't be able to get. Some of them are afraid to go into the clinic. Some of them are afraid to see doctors for various reasons. So we try to just be compassionate and understanding and see them where they're at. There's a lot of feet problem. Just because they're on them all day and it's hard to take care of their feet when it's wet and they can't get dry shoes and socks, so it's very hard on their feet. So a lot of feet problem, a lot of festering, cuts and sores, but yeah, cuts, sores, and feet are probably what we see the most. Everyone does have a unique story that got them there. Some are more tragic than others, but yeah, you definitely have to realize that when you're working with each buddy there and each person they're an individual and they have all their own hurts and pains. And
street medicine is really about helping the healthcare system adapt and address the specific circumstances of people experiencing homelessness. So our healthcare system was not designed for homeless individuals. It was designed more for people like me who have a job, who can take time off to go to an appointment during the week, who know their schedule ahead of time. And none of those things are true for people living on the street. And so even though they have access to healthcare, even though they may have insurance, it's much more difficult to actually utilize those services or to follow up and not fall through the cracks. So on street medicine, we take care out to people on the street. We try to address their needs in the moment, to follow up with them when they don't have a phone, they don't have an address, to make sure that they're still able to get to their follow-up appointment, to make it to their surgery follow-up or to their next visit. And so we can take care of acute medical needs, we can take care of referrals and try to bring them back into primary care and establish that trust that people need to be engaged with healthcare. And then we can also refer them to our community partners for addressing their social needs, like housing or food or other resources they might need. Yeah, so our day-to-day varies with street medicine. So if we are out under the bridges looking for people, it's going to be different than if we're in a shelter where people know we're going to be and we're taking care of people for several hours, and we do that routinely. We also take response calls from our own care managers, from our own clinical staff, and then also from community partners. So if there's someone at the Hope House that needs to be seen, or at the Catholic Charities housing that needs to be seen, we'll be able to come out and see them. So all of that said, I'd say on any given day we see between 10 and 20 patients.